A quadriplegic person is one affected with partial or complete paralysis of both the arm and legs, especially as a result of spinal cord injury or disease in a region of the neck. Due to the lack of fully functioning limbs, quadriplegic patients often need assistance to control even basic conditions of their rooms. The BCI we designed can help quadriplegic patients control different aspects of their room's environment, allowing a person to regain independence at least in this perspective. The only limitation is that the patients must be able to control eye movements. Introducing Sleep Mode BCI, a sleep-style changing device for quadriplegic patients. Here is the room we designed that contains our BCI device and its multiple features. Within the room, patients can control the light in the room by staring at the green LED in the corner. Additionally, opening and closing of the blind can be controlled by holding one's eyes closed for a few seconds. Blinking several times in a given time frame will turn on or off the music. We set a speaker beside the bed to play some relaxing music.
For our patients, we use standard 32-electrode EEG device. The small discs attached are made from silver covered with silver chloride coating and connected via copper wire. Not all 32 electrodes will be wired. Our device only requires 10 electrodes to be active. For the placement of these 10 electrodes, we use the 10x20 system. The electrodes are measured and marked 10% from mesion and 10% from inyon. Only electrodes measuring information required by our algorithm will be wired. The O1 and O2 electrodes are used to measure two different signals, which our algorithm identifies and instructs the device to perform certain functions. SEEP for controlling lights and alpha rhythm for controlling blinds. Electrodes are placed at FP1 and FP2 to measure the alpha rhythm from the frontal lobe. The alpha rhythm from frontal lobe signal that is measured in FP1 and FP2 is then used to control music. F3, F7, F8, F4, FP1, and FP2 electrodes are placed to measure the delta rhythm during sleep. Usually delta rhythm occurs during stage 3 and stage 4 of sleep in adults. The delta rhythm signals become dominant in frontal lobe, therefore measurements of multiple areas of frontal lobe is optimal. Delta rhythms occur when the frequency drops from 3 Hz or less. Delta rhythm is measured so that when the patient falls asleep, the music and lights will shut off if they are not already. FP1 and FP2 electrodes measure two different signals, just like O1 and O2, which our algorithm differentiates and processes accordingly. Electrodes at A1 and A2 are placed as reference electrodes on the right and left mastoid.
If the patient wants to open or close the blinds, a consistent alpha rhythm must be analyzed in the occipital lobe. This can be done if the patient simply closes their eyes for 3 seconds or more. By doing so, the waveform begins to look as so with a frequency between 8 and 13 Hz. Otherwise, when eyes are open, the waveform will have a weaker amplitude and less alpha rhythms. The lights can be controlled by looking at the flashing LED array to elicit an SSVEP response. For example, in the image, a 10 Hz stimulus causes the occipital lobe to light up and have a 10 Hz frequency spike in graph B. In order to minimize risks to the photosensitive population, the LED array uses dot-shaped green lights that are 2.5 cm in diameter. Our array uses 15 Hz frequency stimulus to prevent crosstalk with alpha rhythms and elicit a 15 Hz SSVEP response in the occipital lobe. The music can be controlled by blinking to cause a large wave in the alpha rhythm output over the frontal lobe. Eye blinks act as dipoles and are very noticeable when they occur. In order to determine a voluntary eye blink, the algorithm will analyze the amplitude and the first 0 point of the wave. Image A is the voluntary eye blink, which has a higher amplitude and faster occurring 0 point when compared to image B, the involuntary eye blink.
Here is a block diagram explaining the process to convert brain signals into actions. Initially, the device checks for dominant delta rhythm for 1 minute to determine if the patient is asleep. If the patient is asleep, the device will shut off the lights and music if they are not already off until the lack of data waves indicates that the patient is again awake. It then tests to see if the baseline reset is needed. As a safety feature, if the music intensity is determined to be too high, according to a preset preference, or one of the device features is changing in a way that is not possible based on the current control system, our algorithm sets the room to a baseline of dim lights, closed blinds, and music off, notifies the caregiver, and shuts itself off. After it is determined that the baseline reset is not necessary, the device then simultaneously checks for signals that affect the state of the lights, blinds, and music. If the lights are on and SSVEP signals are detected, the device will turn off the lights. If the lights are off, it will dim the lights to allow the patient's eyes to adjust to the light, and if the lights are dim, the device will turn on the lights. It pauses for 5 seconds after changing the state of any feature, then loops back to checking sleep status. If the device is not detecting that the lights are in any of the given states, on, off, or dimmed, it notifies the caregiver and loops back to checking sleep status. This process of detecting error is repeated for control of blinds and music. Flow of information in the blinds algorithm uses alpha rhythm signals to determine changes in state. If it reads the signals for 3 or more seconds, it will open or close the blinds. Control over music is determined by alpha rhythm signals. Blinking 4 times in 3 seconds will turn on or off the music. Based on the current capabilities of BCI devices, our device is relatively feasible. It only uses 10 of the 32 electrodes, thus slightly decreasing the error associated with electrode placement. Some limitations of our device are lower resolution because it is non-invasive and noise due to signal interference.